Welcome to Focus Orlando, a public affairs presentation of Salem Media Group Orlando. Hey folks, welcome to Focus Orlando. Good to have you here. I hope you're enjoying your weekend so far. And I'm Pete Paquette. And today we're going to be talking a lot about cancer screening and how important it is. Of course, we're just been having the kind of cancer screening week, and that really brings awareness to cancer, something that's touched all of our lives. Whether ourselves, are we a cancer survivor? Are we dealing with that right now? A loved one, people we know, and we see a lot of it in the news too. So I'd like to welcome our guest. Dr. Amber Stevens is here with us today. She's a family medicine doctor in the Tampa Bay area and, of course, all across Central Florida. So, Doctor, welcome to Focus Orlando. Glad to have you here today.
Thank you so much.
You're a family doctor. You see young and old alike, I'm sure, every single day. But when you do see something, that's when it all starts, isn't it?
Correct. My current practice, because we live in Florida, tends to be a little bit more shifted, but definitely have seen everybody, the joke is cradle to grave. Mm-hmm. Yeah. And obviously every patient population has different needs, and that includes cancer screenings. There are even, they don't talk about it a whole lot, but there are even cancer screenings that we do in young infants that are more common there. But mostly what we're talking about here are the cancer screenings most people are familiar with, which are things like breast cancer screening, colorectal cancer screening, cervical cancer screenings, etc.
A good question, though, is why have we really fallen behind on some of these routine cancer screenings?
So, truthfully, especially in the last couple years, it really has been secondary to COVID-19 pandemic. Back when it first started, everything got put on hold. Mm-hmm. So patients who maybe were due for it hit Florida like late spring. And because of that, everyone got behind. So all the mammograms got put off. Anything that wasn't absolutely essential got stopped. And particularly even like colonoscopies, those surgical centers, they weren't doing anything that wasn't absolutely necessary at that moment in time. Well, now you have patients that, for whatever reason, maybe the imaging centers, when they reopened, I noticed, especially on our end, when they reopened, scheduling was very challenging because there was this rush to get in. So people who normally would only take a week or two, maybe 3 weeks to schedule a mammogram, now it was taking them 6 to 8 weeks. So it was taking longer to get everyone caught back up. And then there's still a lot of fear about going into the healthcare facilities. So even though there were proper precautions being taken, people just didn't want to go. They didn't want to expose themselves. So now instead of getting their mammogram annually, it's now been 2 years since they had their last mammogram. Or instead of going to get their colonoscopy done, it's been 2 years since they've had that done. So everybody has kind of gotten shifted behind on the schedule, and we're trying to get everyone caught up, but that takes time. Not to mention, access to care can be an issue. People lost jobs. People lost health insurance benefits. They're not always familiar with some of the low-cost and free options out there, and just it didn't get done.
Yeah, even I'm in my mid-60s. I know I don't sound like it, but no, I'm just kidding. But I'm in my mid-60s, and I guess I haven't really had gone in and done some of those tests like I should be doing maybe. Now, when you see people, somebody comes in, and now do they mention things? Because you probably ask them like, hey, what's going on? How you doing these days? Do they come in with any particular need or particular pain or something unusual, or do you more discover some of these things when maybe when you're with a patient?
Truthfully, the conversation I usually have with patients when we're talking about screening tests, and the reason I'm diverting that direction a little bit is because these tests, they are catching these cancers before they become symptomatic, before they become a problem. So often, when we catch those cancers early, we're catching them before the patients had any problems. That's the whole point of a screening test. By the time someone's really having a problem, breast cancer, it's usually, hey, I've got a breast lump, there's something going on with my skin, I'm getting discharge from the breast. If it's colorectal cancer screening, it may be abdominal pain, there's a change in my stools, blood in the stool. So there's some more involved symptoms that definitely come along with some of these cancers. But by the time the patients are having those symptoms, the problem itself is much more progressed and may even be at a point where it may be treatable in a quality of life, but not so much treatable in a curative stitch.
Yeah.
So the importance of the screening tests really are to catch these issues before they get to that point. If you send someone for a colonoscopy for their colorectal cancer screening, and I use this example because to me, colonoscopies are not just screening tests, they can be curative tests. If you do a colonoscopy and the patient, the gastroenterologist finds a polyp and they take that polyp to biopsy it as part of the procedure, well, if that's a precancerous polyp, you've not only screened that patient for cancer, but potentially prevented them from ever having cancer in the first place because you've now taken what could turn into cancer out. So it's staying ahead of the curve on this in a way that is cost-effective for society because treating things early is always more cost-effective than waiting and to treat it when it's a much bigger event. And the same with breast cancer. If you're doing mammograms, you find a little area of calcification. Maybe you find an area on the imaging that's abnormal. The breast surgeon goes in and they take it out, and you get a little lumpectomy, and you don't need any kind of further treatment. Well, it's better for the patient, first of all, because now they're not dealing with chemotherapy and radiation. But, from just a quality of life standpoint, they can move on with their life.
Dr. Amber Stevens is with us on Focus Orlando today, and the focus is cancer screening. I've had a couple of colonoscopies. Mm-hmm. Did I say it right? But anyway,
colonoscopy,
that is one of, and you mentioned it already, and it's one of the big cancer screenings that you should be doing. Let's talk a little bit about what age for like colonoscopy. So
the time to start screening for colorectal cancer has shifted from 50 down to 45. The other guideline I usually tell patients, obviously, if your family history is significant for a specific kind of cancer, that shifts your screening time frame as well. So if, say, the average age for colorectal cancer screening starts at 45, but you have a family member who got diagnosed at 45, we're screening you at 35. So you need to definitely have that conversation with your physician about when is the ideal time to start screening for you with your history. But on average, colorectal cancer, we start at 45. You can screen. The colonoscopy, I think, is what most people are familiar with. But if you look at the guidelines with the United States Preventative Task Force, they do recommend annual fecal blood testing or Cologuard testing every few years. There's sigmoidoscopy every 5 years, or a full colonoscopy every 10. So there are other options. So if someone is not a great candidate for anesthesia, or they're really nervous about going under anesthesia, it's not the only way to screen for colorectal cancer. So there's options, and that's a wonderful discussion to have with your doctor. The other cancers, breast cancer is also, we tend to start screening around 40. That is a little bit of a discussion because some of the different organizations out there have different recommendations, but pretty much the standards start around 40 every year, every other year, and then at 50 it's annual. Most of these cancer screenings, we stop at around 75 years old. The average age in this country is at death is roughly 75 to 80. So you kind of have to figure out what's the end game here? What kind of cancers are we preventing? How much longer does the patient have to live? And what the benefit is to that specific patient. But breast cancer screening standard is mammography. I know that there is a lot of information out there about different kinds of screening for breast cancer. I have yet to see a single study that shows me that ultrasound is an adequate screening test. Thermography is really an adequate screening test. The reason mammography continues to be the standard of care is because it is the gold standard. It provides the most information. I know people are concerned about radiation, but the reality is most people get more radiation in a cross-country airplane ride than they do getting a CT scan, and an X-ray is like a fraction of that.
Yeah.
So it's not a concern that I would have. I go get my mammograms. I encourage all my patients to do that. That should not even be a real discussion. The other cancers that are common, cervical cancer screening, that starts at 21 years old, so a different population. It is really driven by a virus, so the screening guidelines are a little different based on how the tests are run, and that goes through 65 years old, usually every 3 to 5 years, depending on, like I said, how the test itself was done. And then lung cancer screenings, if someone has a 30, what we call a 30-pack year history, so if you smoked a pack a day for 30 years, 2 packs a day for 15 years, you do the math, okay, then you would qualify for a low-dose CT of the test. And then the screening is annual, usually starting at whenever you hit that 30-year mark. So it could start 45, 60. My patient population, I tend to, because they do tend to be a little bit older at this point, I'm usually getting it in when they're in their 60s or 70s. So those are some good choices in regards to getting those cancer screenings in. And those are really the cancers we screen for most frequently. A lot of the other cancers, unfortunately, we don't have as good of screening tests for. And that's a problem. They're continuing to do research on those fronts. But it's where we're at right now.
And so important. I mean, we're talking with Dr. Amber Stevens. You mentioned family heritage, family history. That's pretty important. We need to be aware of that too, don't we?
Absolutely. Definitely, there are certain cancers that we know run in families. Colorectal cancer, breast cancer, definitely run genetically. There are genetic testing that can be done if it's appropriate. If someone has we call a first-degree relative, so a parent or a sibling or a child that gets diagnosed with, or even really a second degree if it's an aunt or an uncle or a grandparent, depending on what else is picturing. Some of those genetic tests are very helpful. People are protected. I know there's always some concern about your insurance and whether or not they can hold it against you, but people are protected. That information is considered protected, and it should not come into play in getting coverage. But what it does do is give you choices. So if you find out, my family, so it's not my personal family. Say I'm a patient and I find out that my family has a really strong history of breast cancer and someone had ovarian cancer, and I decide I'm going to do the genetic testing and I come back positive. Well, now I have that information to decide, do I want to go see a gynecologist and a breast surgeon and maybe prophylactically have those organs removed? Or do I want to prophylactically go on a certain medication? So it provides some viable choices for prevention. Now, that's thankfully not far and wide the case for most people. Cancers in general tend to be more sporadic than they tend to be genetic. But being aware of your family history, and like I said, if you know that you've got a family history of something, start your screenings early. Make sure you have that conversation with your doctor so that your doctor can let you know when is an appropriate time to start screening for cancer in you personally based on that history.
It's got to get frustrating when you've got a patient that just refuses to have those screenings and some kind of a fear or something. How do you deal with that? How do you get people to just really go in there and get some screenings, any screening that they might need?
Well, I think a lot of it goes back to really having a good relationship with my patient. I make a point, if someone says they don't want to do something, I do discuss with them. I try not to start off with the statistical rate is, breast cancer is 1 in 8 women, blah, blah, blah. That doesn't help the problem. I want to talk to the patient and find out what's really going on. Why do you not want to have this test? Do you have a fear of the test itself? Do you have a fear of finding out the information?
Yeah, what we don't know won't hurt us, right? Yeah.
Right. And there are a lot of people out there, unfortunately, that they just don't want to know. And some of that is cultural. There are certain cultures that deal with cancer differently than mainstream America does. And that's something that we need to be sensitive to. I do have patients that, they're a little, more mature in age and, they're either widowed or they have a family member that went through treatment or whatever their reason may be. And they go, I don't want to treat it. I would just rather be made comfortable. When it's my time, it's my time. And I think that's a real reasonable conversation to have as well. We talk about catching cancers early for treatment, but treatment is always a choice. Someone can decide if they want to have something treated or not as well. So the point of screening tests is to catch cancers early in a patient population that actually wants to go through treatment. So if I have someone, though, that says they don't want to do it, then the next question I usually ask after why is, well, if you did develop cancer, what would you want to do? And if the answer is, well, then I'd want to fight it. And then I go, okay, well, then you need to give yourself the best chance possible. We need to catch this cancer as early as possible, which means doing this test, not waiting until we're behind the 8 ball and trying to play catch up.
Yeah, absolutely.
So,
I know in my colonoscopy, I know they found, I don't know, he said it was something really, I've got to come back more often now because one of the polyps was kind of pretty good sized, I guess. So,
yep, and it mattered.
Yeah, so that must matter, and I'm going to make sure I do that. We have, we see folks in the public eye, celebrities and stuff that maybe pass away, and we go, oh, gosh, I can't believe that person died so young. And then you find out they had cancer, and maybe that sparks a little bit in someone's brain and saying, maybe I should go get checked for that, too. Maybe I should listen to my doctor. Do you ever see an influx or anybody ever talk to you about that? So-and-so just passed away. What do you think I should do, doctor? You ever get that?
I don't see, truthfully, I don't personally see as much of that. Like I said, my patient population is a little bit more elderly. So I think
so they don't really pay attention to that
I get
much,
more of my neighbor just got diagnosed with this and now I'm worried. Or, so I get more of that personal discussion. And so we'll have a conversation about that. I don't see as much of the celebrity stuff. I might see more of that. I used to see more of that when I practiced more full scope family medicine at that point. But because people would go, oh, this celebrity just had this. How do I know I'm not going to get this? I know that there's obviously a lot of discussions about breast cancer with, I think it was Angelina Jolie and a couple other people had the genetic stuff. Kirstie Alley just passed away from pancreatic cancer. I'm waiting for people to start asking about that. And I think it's not just that. I think that those people in general tend not to be, they're not like the everyday man or woman. So I don't think people relate to them that way. I think it's when a family member or the neighbor down the street or one of their old good friends, or it's somebody that's a little more personal to them. That
when it hits closer to home, absolutely.
Yeah.
Whatever it takes to get people to do screenings, that's the important thing. And unfortunately, it is sometimes a tragedy in our lives, in our families, our friends, that gets us off the fence, right? And gets us in there.
Unfortunately.
So you recommended, or you talked about, your relationship with your own doctor. That's so important. How do we help develop that?
So the best thing I can encourage you to do is be honest. I can't emphasize that enough. We are not here to judge our patients. Unfortunately, I think that does happen from time to time. But I always tell people, I do not have ESP. I do not know what's going on in your life if you don't tell me. If, you're finding something and then you don't share it with me, I can't help you. Okay? So we do talk about being honest up front and, having those open lines of communication. I also encourage my patients to make lists before they come in so that they make sure all of their questions are answered. And then we can kind of attack any issues one at a time based on priority. And really just being prepared for your visit. I know that not all doctors have the same time constraints. I'm consider myself pretty lucky that the company that I work with, the way they structure us, I do have a little more time to talk to my patients, which I'm grateful for. It makes a big difference, I think, in the quality of care that I can provide for my patients. But being honest and keeping even if it's a symptom list, if you go, I don't want to forget to talk to the doctor about the fact that I've been having intermittent episodes of lightheadedness. Well, it may not be on the top of your mind when you walk in the door because you hadn't had it for a couple of days, but maybe it would mean that something needs to get worked up. So make sure that you're being aware, that you're keeping track of things, and being willing to talk to the doctor about things that maybe you feel a little embarrassed about. Like if you wipe and there's some blood on the toilet paper, well, I understand that might be embarrassing to you personally, but honestly, as doctors, that's not something that really bothers us to talk about. It's important that we know about those things.
Yeah, it can absolutely lead to something. And so you just really need to, again, gets back to the screening signs. You need to be aware of what's going on with yourself, right? And you need to communicate with your physician. And so important. Dr. Amber Stevens is with us in the Tampa area. Talk a little bit about your practice, doctor.
So I am a family medicine physician, as we mentioned at this point in time. I do mostly geriatrics. My office is in actually Pinellas County. It's in Dunedin. I absolutely love my job. I work with Optum Health Group, which is it's a national company, and we do a lot of Medicare Advantage care in addition to traditional commercial insurances. But to me, I've been very happy with where we're at because I feel like I get to take the time with my patients. The structure of the company is great. And honestly, being able to take care of patients in this stage of life is very rewarding to me. I get to, as it will, help move them through the last stage of their life. So, a lot of patients who are lonely, who don't have a lot of family support, there's some social issues. I feel like I get to actually take care of the whole patient now, which is just fantastic.
Yeah, well, that's great. How rewarding. So thank you, Dr. Amber Stevens in the Optum office there in Pinellas County. There's also one here in the Orlando area too, right?
There's a lot. And WellMed is also part of our company. So I think you all have a lot more WellMed out there, but we have Optum and WellMed. It's the same company through the entire state of Florida.
Well, our focus today has been cancer screenings and getting the word out and just emphasizing with Dr. Amber Stevens some great tips and great information for us today. Doctor, thank you so much. Get out there and don't be afraid to get screened for cancers and all sorts of medical things going on, but so important. Early detection saves lives, right?
Absolutely.
Yeah, Dr. Amber Stevens, thank you so much for joining us on Focus Orlando today. Thank you.
Thank you.
You've been listening to Focus Orlando, a public affairs presentation of Salem Media Group Orlando. This has been a pre-recorded show. All rights reserved.